Hello and welcome. Today we're diving into a fascinating, though sometimes concerning, condition affecting the eye called Commotio Retinae. Think of it as a retinal bruise. We'll explore what causes it, how it affects your vision, and what can be done about it. So, what exactly causes this retinal bruise? Commotio Retinae is primarily caused by blunt trauma to the eye or head. This could be from a sports injury, a fall, a car accident, or even something as simple as accidentally bumping your head. The force of the impact transmits through the eye, affecting the delicate structures within. Let's delve into the pathophysiology. The blunt force causes a disruption of the photoreceptor outer segments, those light-sensitive cells in your retina responsible for vision. This disruption leads to an accumulation of fluid within the retina, specifically within the outer retinal layers. This fluid accumulation manifests as retinal whitening, which is the hallmark of Commotio Retinae. Think of it like shaking up a snow globe. The contents get temporarily dispersed and blurry. While precise epidemiological data is limited, Commotio Retinae is most commonly seen in young males, likely due to their higher participation in contact sports and activities that increase the risk of ocular trauma. However, it can affect anyone, regardless of age or gender, who experiences blunt force trauma to the eye or head. Now, what are the signs and symptoms? Often, Commotio Retinae presents with blurred vision or a decrease in visual acuity. In some cases, there may be no immediate symptoms, and the condition is only discovered during a routine eye exam. The appearance can vary depending on the location and severity of the retinal involvement. Color vision may also be affected. Crucially, the symptoms can range from mild and temporary to more severe and potentially permanent. Diagnosing Commotio Retinae involves a comprehensive eye exam. An ophthalmologist will use various tools, including an ophthalmoscope, to examine the retina directly. Optical coherence tomography, or OCT, is also a valuable tool. OCT provides detailed cross-sectional images of the retina, allowing for a clear view of the retinal swelling and disruption caused by the condition. Fluorescein angiography might be used to rule out other conditions. While Commotio Retinae isn't typically classified into distinct types, the severity and location of the retinal involvement can vary. Some cases might involve the macula, the central part of the retina responsible for sharp, detailed vision. When the macula is affected, it's referred to as macular Commotio Retinae and can lead to more significant visual impairment. The primary treatment for Commotio Retinae is observation. In many cases, the condition resolves spontaneously as the fluid in the retina is reabsorbed. Regular follow-up appointments with an ophthalmologist are crucial to monitor the healing process. In some cases, if complications arise, such as cystoid macular edema, a fluid accumulation in the macula, treatment with topical or oral medications may be considered. In rare instances, other interventions might be necessary, but this is dependent on the specific complications that arise. Prevention is key when it comes to Commotio Retinae. Wearing appropriate eye protection during sports or activities with a risk of eye injury is essential. Seatbelts in cars can also significantly reduce the risk of head trauma and subsequent Commotio Retinae. Be mindful of your surroundings and take precautions to avoid falls or accidental bumps to the head. The prognosis for Commotio Retinae is generally good. In many cases, vision recovers completely within weeks to months. However, in some instances, permanent visual impairment can occur, especially if the macula is significantly affected. Recent research is focused on understanding the cellular and molecular mechanisms underlying the retinal damage and exploring potential therapies to accelerate healing and improve visual outcomes. For example, studies are investigating the role of anti-inflammatory agents in promoting retinal recovery. Always consult with your ophthalmologist to understand your specific prognosis and treatment options.